What interested me in public health was my exposure in community health research, and where I was able to work with at-risk youth. And being a second lieutenant in the Canadian Forces, I was able to directly work with adolescents and teenagers and really got to foster my skills in the community, which really led me to this program. When I was researching for master's programs to look into, I spoke to Dr. Corinne Kariaka, who is very passionate about the MPH program and the opportunities that we get to work with in the Nassau County, Suffolk County, and really just get involved in Hempstead. It was really powerful for me because that's what I wanted to do, just get involved, and that's what made me come to Hofstra. It's just the passion of the program. So in my MPH program, I got to participate in SOPHA, which gave us a lot of opportunities. I got to be involved in Voice Day, National Public Health Week, which was an amazing event that happened in April, which we're allowed to visit different conferences that were held by a lot of faculty members with different outside organizations. Specifically for me, I got to be involved in the Minority Health Conference, in where we were able to have high school students at our event, and we got 40 different organizations, health related, to really just promote health wellness. And as a graduate assistant, I was fortunate to work with Hofstra's event management under the supervision of Jennifer Piran, and I got to really develop and understand what Hofstra is all about, working with different departments and understanding the community they built with it, and it was a great networking experience. So my internship was with Dr. Edward Cofield in the health profession, who is a professor at Hofstra University. I was very fortunate, and I got to learn from him to develop a large-scale data set, which involved looking at 50 different states, and we were looking at the academic performances and building a data set in Excel, which accompanied different academic performances. This actually transitioned to a larger experience in where I was able to write my cumulative report and analyzing the data sets and looking at nutritionist policies. In the MPH program, we got to learn from different esteemed professors, especially Dr. Santella, Dr. Hackett, Dr. Novak. They gave us a really good understanding of what public health is. I got to develop really good relationships with two professors. One was with Dr. Alicia McDonald, who's an epidemiologist at North Shore LIJ. She has given me the opportunity to intern with her at North Shore LIJ for 1 year, which is a great opportunity, and I hope to learn a lot from her. And the other professor I got to really connect with was Dr. Edward Cofield. He has instilled amazing knowledge with me, especially with economics and making cost-effective analysis and using models to understand data at a whole different perspective to make implications of policies. So I've been very fortunate to receive the Margaret E. Mahoney Fellowship, which is a very competitive fellowship under the New York Academy of Medicine. They only accepted 8 candidates of all of New York State, and I was very fortunate to be one of the recipients. This fellowship is actually an eye-opener because it integrates both policy as well as looking at research for the disadvantaged population. I was very fortunate with Dr. Edward Cofield as my mentor, who was able to guide me and really help foster my skills. I was able to translate my experience and my cumulative experience and my internship and use that research to apply for this competitive fellowship. The fellowship allows us to meet different personalities, especially leaderships. I get to meet the Deputy Mayor of New York City. I get to visit the Commonwealth Funds, which is going to be an amazing experience. Just having the opportunity to network in a field that is very academic oriented in the community health world is an amazing opportunity.